files with our individual health histories have always been scattered among different healthcare facilities and professional offices. None of them complete, all of them difficult to collect and combine. It's a problem whose solution would have extraordinary benefit for all of us. At a time, in a place like any other place, something extraordinary is happening. It's called MHIN, short for Michiana Health Information Network. A fancy name for a simple idea: making life better for just about everyone who lives here. And like most extraordinary things, this one is found in an unexpected place. A little house in a little town in northern Indiana.
Having a health information exchange in our community is just a tremendous asset. It's a wonderful tool. It allows the sharing of important, vital clinical information across organizational boundaries. We haven't had that before.
MHIN is basically the vehicle that the providers in this community started and funded years ago, a community-based model, an approach to gather physician records from all over the community and put them in basically an electronic medical record, store them securely, and provide access to those physicians that have a relationship with the patient and need to know so they can treat them better.
In order for physicians to get information, they depended on the suppliers of the data to send it to them, deliver it to them, or they had to call on the phone or get a fax. And it was all disjointed. And someone in the office had to put it in a record, and a lot of times it wasn't in the right place. Things weren't together, so if you had two results of the same test done 6 months apart, there'd be lots of paper in between those two results. They weren't side by side, so you really couldn't compare them.
I think everybody today underestimates the amount of time that a patient takes just gathering up reports and gathering up copies of x-rays. The Michiana Health Information Network will eliminate all of that.
Late 80s, early 90s, most providers, such as the South Bend Medical Foundation, were looking for a way to better connect to physicians and a better way to get our information back to them. We were literally bumping into each other in physician offices, introducing our PC products.
So they came up with the idea of sharing a common infrastructure to deliver that information to the physicians in a single platform. And that's really what Michiana Health Information Network is.
It's modeled like a utility. In other words, the company is set up to be open to all, and basically its goal is to connect all the people involved in the delivery system.
MHIN is looking at itself as a utility.
So the utility means open to everyone.
Well, it'd be ideal if all the hospitals in the area and all the physician offices were involved in it, because you just have that much more information when a patient comes to see you. That would be ideal. I'd like to see that happen.
By having a hospital in Mishawaka, one in South Bend, and one down in Plymouth or Marshall County, we do have specialists that go to all these hospitals and primary care physicians in 55 different practices throughout that region. This system will help connect them and improve their care. It will also improve the process of transferring orders and referrals and allowing our patients to flow through the St. Joseph system more effectively. So it's a wonderful asset for our community.
Emergency room physicians tell me it's a wonderful tool because even if they know a patient is en route, critically ill patient, and they know the patient's name, they can go to the computer, they can look up the results, they can see what has happened to that patient in the past in terms of previous hospitalizations or consult notes, etc. And they can have a treatment plan fairly well mapped out, formulated before the patient and the ambulance ever arrive.
It's certainly in the patient's best interest for us to have complete information about them.
When that patient comes in, they have saved critical seconds or minutes that could make a difference between life and death for that patient.
Several months ago, I was working a night shift and I received a call from some fairly panicked paramedics who were bringing in a patient with acute respiratory failure. And they were about 5 or 10 minutes from the hospital and were inquiring what they should do. And by identifying her and being able to find out more about her recent past medical history, medication list, and so on, when she hit the door, we were much more capable of responding quickly and appropriately to her needs.
From a community perspective, broad community, I think that overall the medical delivery system, there will be a tremendous savings, and that savings will be passed on to employers who are ultimately pay the bill. Hopefully we can demonstrate to insurance companies that there's a more efficient delivery system here and thus reduce premiums to employers and to consumers.
When you're dealing with insurance companies, everybody wants to know what each visit entailed. Closing the loop in that process was difficult in the paper world. EMR really has helped close that loop quicker. Everybody has access to the information that they need.
Can you imagine a physician's office that had to have a computer terminal from every provider in town to look up the results? This is a really great way. One wire, one terminal, one sign-on, access to a person-centric record, a shared utility, shared resources, that the benefits go to everyone in the community, not just the ones that are the first movers or the ones with the most money.
What I'm excited about is it can connect with the patient, the consumer.
If the hospitals truly put the patient in the center, then they would put the medical record with that patient in the center and know that strategies of competition really won't work in this scenario.
Sure, there's going to be lots of benefit to providers, physicians, hospitals, other medical providers, but when we can connect the consumer, the patient, so that they can be more empowered to manage their own health, they can be better informed about their health, their family's health, they can have access then to lots of content, evidence-based content, in the privacy of their own home, and they can communicate back and forth between their physicians in a secure network environment. What a tremendous advantage that's going to be.
South Bend is uniquely positioned for that with two very strong hospitals, a great regional laboratory, and physician practices that were very well automated when this thing started in the early 90s. In this community, without federal government funds, without grants from the outside, they took it upon themselves, to do this. I think some of the other people are waiting for, so who's going to pay me to do this? I think this community has the spirit and the drive and the togetherness to pull this off.
Here, in this place, a place unlike any other, something extraordinary is happening. It's called Michiana Health Information Network, a fancy name for a simple idea: medicine at the speed of life. From the people in this house, in the little town in northern Indiana, the Michiana Health Information Network.